getting answers, uncovering the truth. Boston 25 News investigates.
Healthcare Heroes, that was the name of a fundraiser for frontline hospital workers on the North Shore. Now, 25 Investigates has learned the Massachusetts Attorney General's Charities Division has been asked to follow the money.
As investigative reporter Ted Daniel explains, donations were collected during the COVID pandemic.
This story started with a tip from one employee at Anna Jaques Hospital in Newburyport. We checked with the Massachusetts Nurses Association. The union confirms it also has concerns about where the money ended up.
That was a really tough time for me and my family.
We asked Kevin Kenny to take us back to November 2021 and the 8 nights he spent in intensive care at Anna Jaques Hospital fighting COVID.
It sounds like it hit you like a ton of bricks.
Yeah, it did. You know, I was almost saying goodbye to my family.
He credits the doctors, nurses, and other staff for saving his life.
It just meant a lot to me because I really think they saved my life. We really want to donate some money to the nurses that took care of me, and they suggested that we give to the Nurses Heroes Fund, and that money would go to the nurses that took care of us.
Kevin and his wife owned a sports bar in Salisbury at the time. He held an event that raised $800 for the Anna Jaques Healthcare Heroes Fund. Anna Jaques posted this video on Facebook in April 2020 advertising the fund. The caption says donations directly support frontline staff with critical resources as we face this pandemic head on.
The Massachusetts Nurses Association says it began asking hospital administrators about the fund in early 2023. The M&A wanted to know how much money was collected and how it benefited frontline workers.
The M&A says it took Anna Jaques more than a year to provide a detailed accounting. In a February letter, a hospital administrator says the Healthcare Heroes Fund raised more than $200,000, and the money was able to offset some of the unexpected expenses of the pandemic. The hospital says it spent $515,000 on safety measures like PPE, $869,000 on 3 years of COVID sick pay, and $98,000 on events and meals for staff, including Thanksgiving turkey dinners. The M&A says the hospital records showed a laundry list of mostly routine hospital expenditures.
Are these fair questions that the nurses are asking?
Oh, absolutely. Absolutely fair.
Haverhill-based attorney Marcia Casarosian is a past president of the Massachusetts Bar Association. She says it doesn't appear the hospital did anything legally wrong, but
this is what you want to avoid when you're creating a fundraising event and you want specificity to avoid this kind of questioning, or at least head it off at the pass.
A hospital spokesperson tells 25 Investigates all funds and resources were distributed appropriately to support our dedicated team as we navigated the unique needs of an unprecedented global health crisis. Kevin Kenny says the reality did not match his expectation.
My expectation was it was going back to the department, back to the ICU, giving them maybe some gift cards or something to help them and their families. I think a lot of people donate these funds expecting them to go to the right, location and to the right people. And if they haven't done that, then we've got to understand why.
Neither Anna Jaques nor the M&A would speak to us on camera. The hospital tells me Healthcare Heroes covered only a fraction of the pandemic cost incurred by the hospital. State Attorney General Andrea Campbell's office would not confirm or deny any involvement in this dispute. We will let you know if that changes. For 25 Investigates, I'm Ted Daniel.